Hi, my name is Jason Sparks, and I was diagnosed with ulcerative colitis in 1999, autoimmune hepatitis in 2007, and primary sclerosing cholangitis in 2012. And last October, on October 29th, 2022, I had a directed liver transplant from a stranger. With October being National Liver Awareness Month and October 29th being PSC Awareness Day, I wanted to record a little video about how my life has changed since my transplant and particularly with my quality of life. From the period of time between my diagnosis in 2012 and the summer of 2021, I actually had pretty stable symptoms related to my PSC. I dealt with a lot of chronic fatigue and periodic nausea and periodic pain and discomfort in and around my liver. And things were pretty manageable. I napped a lot each week, and that sometimes interfered with my ability to work or to honor certain plans. But by and large, my PSC and my liver disease was pretty stable. And then in the summer of 2021, my PSC in particular really started to evolve. And I developed some new symptoms, including varices in my esophagus, jaundice in the whites of my eyes. I had ascites in my abdomen. I developed a clot in my portal vein, and that resulted in some portal hypertension. And then in the summer of 2022, I started to develop mental confusion. And that symptom in particular, in concert with all of the other ones, was really hard for me to deal with. It felt like it really marked a significant change in my liver disease and my health, my overall health. And I knew that it was going to start to require some more time and care and attention as my liver health started to devolve more aggressively. Since my transplant last October, I've been doing really, really good. I feel fantastic. I no longer nap each week, and my labs are in a great place. And it's really surreal to me that I don't have liver disease anymore. I remember when I was in the hospital last November, my hepatologist came to visit me and he said we would be transferring my care to the liver transplant clinic at the hospital, and I would no longer see him. And I asked him why, and he said, because you no longer have liver disease. And it still gives me goosebumps to think about that after being sick for more than 2 decades and having liver disease for 15 years. And it's a bizarre feeling to have a fully functioning vital organ. I certainly feel better because I have a healthy, functioning liver now. And I also feel like there's been a really big emotional weight lifted off of my shoulders. Prior to my transplant, as my health worsened, I had many sleepless nights where I would lay awake in bed thinking about my health and the liver transplant I would need and what would happen if I didn't get one. And it started to take a really big emotional toll on me. And I relied really heavily on my friends and family and my therapist. And since my surgery, it's been an interesting emotional ride post-transplant as well. But I feel like a really big emotional burden has been lifted off my shoulders. I feel a ton of gratitude each day. I feel excitement for the future. I feel relief. And I also feel, a lot of grief and survivor's guilt and fear for the future. And that's because I know that a liver transplant is not a cure for liver disease. And that breaks my heart for me and for every other PSC patient who's had a liver transplant or who needs a liver transplant. And I also feel a lot of fear around recurrent PSC and organ rejection. And while the first 3 to 6 months post-transplant and the first year in particular are kind of the most acute and highest risk phase, organ rejection and recurrent PSC can happen at any point. And that is just part of my reality now that I have to kind of accept and metabolize and process. And even as I follow my care team's directions and guidance to a T. And I think the other big piece post kind of transplant that I am feeling with my quality of life is I just feel more emotional and physical relief, and I'm not as scared to go out and do things that I once was. In the last 12 months, I've been able to go to Sedona a few times. I've been to Mount Shasta and the east coast of the U.S. I was in London for about a week in July. And it's felt really good to be able to travel again. And there's still certain precautions that I take now, and getting travel insurance and making sure that I have a plan in place in case I get sick while traveling. And I'm not as scared to live again and to kind of get out and live life. And to me, that is the greatest way to honor the gift that I've been given by my donor and my donor's family, is to make the most of this time that I have, time that I wasn't supposed to have and didn't expect to have. And really just make the most of this time that I do have. And I think the final kind of thing that I want to share is that this is a really unique experience. There are only, having a liver transplant, that is, there are only about 10,000 liver transplants in the United States each year. And we're a really small community, and especially those of us with PSC who have had liver transplants. And I'm just really grateful for the network and the community that I've found with PSC partners, both pre and post-transplant patients, and being with a group of people who get it, who really understand what living with chronic disease is like, what living with a liver transplant is like, the fear that comes with it, the joy that comes with it, the relief, and just being around people who understand the mental and emotional weight that living with PSC and other chronic diseases can have. So on this October 29th, PSC Awareness Day, and the 1-year anniversary of my liver transplant, I wish all of you great health and continued ease with your medical journeys, and sending you all love and blessings. Thank you.